Hello, everyone, and welcome back to Shock Doc Medical. I'm Dr. Rod. Today, I want to dive into a topic that's both eye-opening and deeply concerning. The link between early-onset hypertension in Black women and the risk of stroke later in life. Now, human conversation is so much more than just a back and forth of words. It's about the emotional nuance, the shared context, and the empathy that binds us together. And today, we're bringing all of that into our discussion. A recent article by Sue Hughes highlighted some truly startling findings. According to observational data from the Black Women's Health Study, Black women who develop high blood pressure before the age of 35 face a threefold increased risk of having a stroke in midlife. Even those diagnosed before 45 see a doubled risk. These numbers are more than just statistics. They represent real lives, full of dreams, careers, and families that can be drastically affected. Dr. Hugo J. Aparicio, the study's lead author and an associate professor of neurology at Boston University, emphasized something that really struck me. The really concerning thing about this data is the high proportion of young Black women who have high blood pressure and are suffering strokes relatively early in life. Think about that for a moment. These women are often in the prime of their lives, juggling professional responsibilities and caring for their families, yet they're facing a burden of disability much earlier than anyone would expect. Now, in any human conversation, especially on topics as critical as health, context matters. We don't just exchange data, we share concerns, ask questions, and express genuine care. In this case, the data forces us to ask, why are these strokes occurring at such a young age? Dr. Aparicio is set to present the full data at the upcoming International Stroke Conference in Phoenix, and his research urges us to take early blood pressure screening seriously, even among young adults. What's particularly interesting is that the study didn't just stop at the numbers. It also pointed out that psychosocial stressors, like financial challenges, systemic racism, and the pressures of supporting multiple generations, play a significant role in the early development of hypertension. Dr. Michelle A. Albert of the American Heart Association reminds us that these stressors not only elevate blood pressure, but also hinder the ability to seek and sustain treatment. As we talk about these findings, it becomes clear that our conversations about health need to be multifaceted. Just like a good chat over coffee, we're not just tossing around facts, we're connecting over shared human experiences. We talk about how stress, lifestyle, and even the simple act of checking your blood pressure can be life-changing. So, what does this mean for all of us? First, it's a wake-up call that hypertension and stroke aren't problems confined to the elderly. They affect young people too, especially young Black women. This calls for earlier intervention, better screening methods, and a community-wide effort to address not just the physical aspects of health, but the emotional and social challenges as well. I encourage all of you to think about your health holistically. Talk to your doctors, ask questions, and if you're a parent or caregiver, make sure that blood pressure screenings become a regular part of your family's healthcare routine. Small changes in lifestyle, like improved diet, regular exercise, and stress management, can make a huge difference over time. Thank you for joining me today on Shock Doc Medical. I hope this conversation not only informed you, but also touched you on a human level. If you found value in today's discussion, please consider subscribing, sharing this episode, and leaving your comments. Let's keep this conversation going, because when we share and care, we can all work together toward a healthier future.